The final question was about hanging, because a lot of people have been using evolutionary arguments about monkeys hanging from trees and that we don't do enough hanging and that's why we have back pain. And I remember from your chat with Chris, you likened hanging to a cheeseburger and the cheese being pulled apart, and that's what's happening to the discs. Is there any place for hanging in someone's training program if they have back pain?
The answer is absolutely yes. And I'm going to give you some examples, and the answer could be absolutely no, and I'll give you some examples. I don't quite recall the context of that with Chris, but in any case, let's take the person who I will ask the question, do you have sharp pains rolling over in bed? And they answer yes. And then they go on one of these decompression machines, which is basically a traction or hanging, and they get worse, not realizing that what was causing the pain triggering rolling over in bed experience was the picking of the scab of the micro movement. So if we teach them, add a little bit of an appropriate brace, roll over a straight leg. In other words, I use Elite Jiu-Jitsu 101 to teach them how to roll on the ground, just as a Jiu-Jitsu master would, very efficiently and effectively. Put that joint into traction where it needs more stiffness would be the polar wrong thing to do. Stiffness would apply. Now I'm going to take the American powerlifting champion for men over 70 years of age, Masters champion. We have to build training capacity. So he deadlifts over 400 pounds. So if you can imagine being over 70 years of age, and trust me, you have no context for this yet until you get there. I'm getting quite close myself. So 400 pounds, I couldn't consume that 20 years ago, but I sure can now. In order to build training capacity, that athlete does one rep of, say, 80% of competitive load. That capacity is all used up. So in order to build capacity, we would then hang them on the bar. And that allows the disc and structures to restore to allow another repetition. Or I might do a thoracic spine extension stretch as a restoration and an antidote for the huge amount of capacity they just used up. So do you see, there's an example of it was the right, perfect thing to do. And I gave you an example of when it was the perfect wrong thing to do. Does that give a context for traction? Now, if I want to suck in a disc, I wish I had you when you were at the peak of your discogenic
Oh, me
acuteness.
too, Stuart.
I wonder if we could have had you quietly lay on your tummy, and with each exhalation of breath, you would let the tension come out of your body. And then I could play and pull with some traction on your legs. And then I could do a little windshield wiper routine like this and watch your pelvis gently roll, because out of our laboratory, we would measure as the disc bulge starts to grow, we can get it to vacuum and retract back in with a little bit of traction, and it vacuums in even faster with a little bit of motion. But if the person has combined instability, it now became poison. So do you see how we even have to, I call it romance. We have to romance the joint and keep playing with the nuances to find out what the very best vacuuming is. So a decompression machine hanging upside down with decompression boots are just,
It's
there's
a
no
bit of a blunt,
intelligence. Well,
blunt force.
it's a blunt force. There's no intelligence, there's no skill to it. But a skilled clinician can just romance that joint and produce the effect. And if they
Finesse
get,
the disc. One
that's it.
that makes perfect sense. Stu, I appreciate
There's an
you've
art
got.
and a science to all of this. That might be a good summary to leave on. The great clinicians, they know the science, but they're also artists. And that's another nuance that gets lost. If you don't have good hands, if I can get a phone book and I'm going to pull out a mustache hair and I'm going to place that hair under the first page of the phone book, I want you to find the hair. Because if you can't, you have no ability to feel a little twinge caused by back pain. that you didn't have to ask them if they had pain. You saw it in their eyebrow, and you saw it, you felt that motor unit fire with just that little grab. Now go to 2 pages under the phone book. Now go to 3. Now we're getting to the level of perception. So that's an art. So do you see you need art? You need art and science. Sure, yeah. Training clinicians is.
Stu, that is a great place to end it on, and I appreciate we've gone over time. Thank you for going through all of this. And
now you know why I keep the mustache.
Yeah. I see. It's a critical training tool.
Yeah, it's a source of palpatory skill device.
Oh,